thank you everyone for tuning in to TAYFFI Talks, presented by Truly Alive Youth and Family Foundation's COVID-19 response program. Today's questions and discussion will be based around the very important theme, to wear a mask or not to wear a mask. That is the question. Our esteemed guest speaker today is Dr. Nazeem Muhajarine. He is a professor with the Department of Community Health and Epidemiology in the College of Medicine at the University of Saskatchewan. He is also a director with the Saskatchewan Population Health and Evaluation Research Unit. Over the past 2 decades, Dr. Nazeem has established an exemplary record of research, teaching, mentorships, and service. Working with citizens, policymakers, and like-minded researchers, he tirelessly leads innovative projects that have profound impacts on a wide range of stakeholders. His motto, "Think globally, act locally," guides his research and has led him to focus largely on projects that address widespread social issues. Obviously, the topic today fits into that, the impact of COVID-19 on our community. Just a little bit about TAYFFI. So Truly Alive Youth and Family Foundation, Inc. is a Saskatoon-based nonprofit organization. We provide support services for youth and families, especially members of vulnerable populations, in order that they feel empowered to become engaged and contributing members of their respective communities. Myself, the facilitator for today, is Candice Fox, and I'm the COVID-19 Response Program Coordinator with TAYFFI. All right, so thank you so much, Dr. Nazeem, for joining today.
Oh, you're welcome. Happy to be here.
We have a ton of questions to go through. We're going to try and fit these all in an hour. Some of these questions are from clients, some of them are from staff, some of them are from supporters, and we're going to cover a wide range of just general questions to some around school, culture, and ethnic groups. So I'm just going to jump in and ask how you are doing and how COVID-19 has impacted your work thus far.
Well, I'm keeping well, thank you very much. And the work has been many and numerous and kind of urgent nature since we began to stay home in mid-March. I've continued my work. A lot of research, but continuing with my regular work, working with students and committees and so on.
Awesome. So our first question is, can you explain a little bit about how coronavirus is different from, say, a flu or cold virus, and what you have learned over the past 4 or 5 months?
Yeah. So SARS-CoV-2, which is the acronym, the short name for this new coronavirus. So coronavirus is a class of virus that affects people. There are about 6 or 8 coronaviruses that has been found to affect human beings. Most often coronaviruses, they circulate among animals.
Okay.
And sometimes they jump from animals to human, Homo sapiens, human beings, So this is the situation. This is one example of that. And the coronavirus 2 is a new virus. We have never seen this virus, at least not in the human species.
Okay.
And it is it's a virus that you would have seen pictures with little crowns-like structures kind of embedded in the surface of it, which is why the name corona, Latin for crown, comes in. But anyway, it's a virus that attaches itself to a couple of receptors of the cell lining, of human beings, particularly in the nasal and upper respiratory, passages, or in the mouth, and it actually sort of makes its way in. It hijacks the human cells, and it then sort of gets human cells to reproduce, in many number. And so that is actually how it works. So the couple of things to take away is that it's a new virus. We are still learning about it. It is not mutating very quickly, but we haven't seen this for a long time yet. We are still only talking about 8 to 9 months, so although it is mutating a little bit, it's not mutating so much that it is presenting in a different way at different times. And the other thing is that it is contagious, obviously, and so we usually talk in relation to reproductive number, the basic reproductive number, which is really the number of people a person who has the virus will pass on, to susceptible individuals. So the reproductive number is 2.4, which is a number that we got from Wuhan and in Hubei province in China in early this year, in January and February, which means that one person can give the virus to 2 people, and then 4, 16, and so on. So it's an exponential growth. In fact, when you say 2.4, it is more than 2, between 2 and 3 people.
Wow. Okay. That leads actually perfectly into my next question. So a lot of conspiracy theorist groups are saying that this is a man-made virus, or it was manipulated in a lab. Can you shed some light on that at all, or why people might think that it would be a man-made virus?
Well, it's very difficult to really really sort of find a reason why people might be saying that it's a man-made virus. People cannot make a virus. We haven't actually. What I'm saying is that we haven't seen precedents anywhere, history, where people have made a virus and propagated them intentionally. A virus that we have not, that had not existed before. But we do know that actually under microscopes and so on, that this virus resembles the SARS-CoV-1 virus, which afflicted human beings in 2002, 2003, the first round of SARS, and Canada, particularly in eastern Canada, in Ontario, many people died. So, there is actually no basis that I know of, that has any for that kind of a claim that this was made in a lab and propagated, by human beings. No, we know that this actually might have come from bats, and jumped from a bat to perhaps to another animal, and then then humans.
And then to a human. Okay. Do you think in comparison, Saskatchewan is sitting okay when we look at other provinces with our numbers and the spread of COVID-19, today?
Today, actually, we are sitting in the middle of the pack of the 10 provinces, and there was a time back in July, second week to the end of July, we were at the near top in terms of actually, having the number of new cases and so on. But talking on August 31st, we are probably 6th of the 10 provinces in terms of number of cases per population. So we want to make sure that we relate the number of cases to a denominator, and that is, to a population base. So we are actually doing not too badly. And in fact, this morning, the number of active cases in Saskatchewan, where we are now, is only about 10, I believe, so that is not in a population base of about, at 250,000 people.
Yeah.
So that is actually a very good place to be.
And would you say that we're still very much in the first wave of the virus? And when we hear about first wave, second wave, When will we know when we're in the second wave?
Yeah, it's a interesting sort of a way to refer to this kind of pandemic, the epidemic curve. So when we talk about a wave, what we are really talking about is how the virus increases exponentially. It's in an acceleration phase of a curve. This is a curve like a bell curve, if you will. Acceleration phase, and it reaches its peak, and then it starts to descend, and then flattens out. So that one cycle, that going up and coming down, is referred to as one epidemic curve, one cycle, one wave. But I think this is that is the textbook scenario, but in real life, in real situations, things don't happen exactly that way. There is an acceleration phase, achieving a peak, and a deacceleration phase or flattening phase, but it may not come down to the base level, and it might actually see going up again, like we saw in the states, in many states, in the U.S., and to some degree in some of our provinces as well. I'm thinking of BC, for example. We also had a little bit of a surge in July. Like I said, it is very difficult to say that this is a second wave. In fact, I think that was not the second wave that we saw in July in Saskatchewan, for example. It was still the first wave, but it had a second iteration of acceleration phase. A true second wave might be a resolution. In fact, a number of months of very low numbers. So there's a a near complete resolution, and kind of flattening, and then a second wave, and quite separate. Yeah.
Okay.
Before we got to that resolution, in a way, to the base, we saw a jump in numbers, in July. So it's not really, I think it's still the first wave, in my mind, is the first wave, a second phase of the first wave, if you will.
Okay.
And, we didn't actually have enough time to have that flattening, that resolution of that first wave of infections.
Okay. CTV News reported in August that some results that were conducted by Angus Reid Institute showed that Saskatchewan has the highest number of individuals who are not complying with COVID-19 safety protocols, meaning wearing a mask, using hand sanitizer. Is that alarming for you to hear, especially going into school season, where parents are sending their kids to school, and if kids see mom and dad not complying, maybe they won't? What is your feeling around that?
So first of all, I did see that that report, and the newspaper articles that reported on those results. In fact, Angus Reid Institute has been doing a national survey of a national sample. Every so often. This is probably the third such survey that they reported on. A different theme each time. This time it was about sort of compliance with mitigation, strategies. A couple of things I want to say. One is that this sample is a national sample of about 1,500 people, Canadians. The Saskatchewan portion of that national sample is about between 200 to 300, people. About 230 to 40 people. Although they give error rate, how accurate these estimates are, because you are estimating from a sample, and you're not getting all the population, all the Canadians, or not everyone in any province. You're sampling, and that sample has to be representative, but also it has to be accurate. So for 1,500 sample of Canadians, the accuracy rate might be plus or minus 3 percentage points of that, percentage. But in a sample of 230 or 240 for Saskatchewan, that error rate times, very, to a lot, So I'm not so sure how accurate that estimate might be for Saskatchewan. For
Okay.
all of Canada, it might be a certain accuracy, but for Saskatchewan, and they are actually making claims and pronouncements based on each province, but the sample size for each province varies,
Very different.
a great deal. So that's point number one. It's a little bit of a technical point. I mean, bear with me, but I have to say that. And the second point is that we have actually been doing similar survey with 1,000, Saskatchewan respondents, each month starting in early May. And we have been collecting data on some of the same behaviors, like mask wearing, hand washing, and not touching your face. And what would you do if you were to have any symptoms, like COVID-like symptoms? Would you stay home, or would you call 811? Would you get yourself over to a clinic? Things like that. So we have been collecting those data, and I would say it varies from behavior to behavior. I wouldn't say that Saskatchewan lags many of the other provinces. We are not on the top either. I think there are some other provinces where people are complying a lot higher. For example, mask wearing.
Yeah.
People in Ontario, BC are complying at a higher rate than people in Saskatchewan. But we are not the last. I would not say that we are the last. I haven't done this kind of a robust sample survey in all of the provinces, but I wouldn't think that we are in the basement, of this.
Well, that's good.
So yeah, I think we have to be cautious. We have to be concerned, and continue, this mitigation behavior as we return to school and some people return to work. But I don't think we have to hang our head and bemoan the fact that that we are not doing as much as any other province are doing.
Okay, so we should the red X over Saskatchewan.
I don't think so. Not yet. Not yet. I think we are doing okay so far.
Okay. Initially, Canada's Health Minister, Theresa Tam, along with our Saskatchewan Chief Medical Officer, Dr. Shahab, they were not pushing so much to wear a mask. And then in May, we saw a little bit of shift of messaging along with, WHO and the CDC. And now it's very much, pushing to wear a mask. And in some places in Saskatoon, it is mandatory. Why do you think there were such mixed messages around, should we be wearing a mask or not? And why is it so pushed and recommended now?
Yeah. This in this whole pandemic, the mask wearing thing stands out for its mixed messaging. It's kind of, and how unclear the messages were, if you were to track it from the beginning, at least in Canada and North America. I think there are two things that come to my mind. And one is there was a real concern that there wasn't enough personal protective equipment, meaning mask and other things for those people who are in the front lines of treating patients, so hospital workers and healthcare workers. And we really only knew, back in March, surgical mask and N95 mask. We really didn't talk about non-medical mask or hand, hand mask. So we were really only talking about those masks that you purchase that are made for its intended purposes, for to keep people safe. So I think there's a real concern there, and I think that really drove back in March, in the early phase, in the early weeks and months of the pandemic, to make sure that there was not enough, there's enough masks that they had for the healthcare workers. And I think that is the right thing to do, because we want the frontline workers to be protected, because if they fell ill, we would be able to actually treat other people. The second thing I think is a little bit cultural, and I think this continues to this day, And the cultural element is that North American society are not used to covering their faces in public, but there are many other cultures in the world where uh, covering your face is actually not uncommon, whether it be by women or sometimes even, like men, especially if they want to protect themselves from a sandstorm or whatnot, they will cover their face. Um, there are Asian cultures where mask wearing in public to protect themselves and others from any cold or any sickness is actually quite common, So that is not the case, in North American society. When we see somebody wearing a mask and we can see their mouth and nose, just the eyes, we are a little bit perturbed. We are wondering what are they hiding, and also, and also we associate mask wearing with, you know, mischievous behavior, perhaps malfeasance. So like trying to hide your identity. You know, and I think that so there's a societal, cultural element to this as well that really still gets in the way of mask wearing. Mandatory mask wearing or not wanting to wear mask at current times, during this pandemic.
And I think it has been common for anyone that travels to see on occasion people wearing masks in the airport, but it has always been assumed that either they're sick or they have a compromised immune system or something was wrong. And so I think it is, especially for us, people who don't think that they are sick, maybe they just don't understand the benefits of wearing a mask if they don't have the actual symptoms too.
Yes, I think that's right. I think we have understood in terms of mask wearing, it does protect the other person from a source, from a source patient. So so the droplets, the tiny droplets that you might be exhaling, are actually, there's a physical barrier from getting it outside of you, so that's a source protection. It protects other people, but it might actually also protect, the wearer as well. So a healthy person wearing a mask, would also be protected from somebody who might be exhaling or, those tiny droplets, of virus. So I think in the past, though, pre-COVID time, most people wore a mask because they were a little bit sick and they didn't want to give it to others,
right,
as well as they didn't want to get sicker. So mostly because they didn't want to give it to others. And yeah.
Perfect.
And one other thing I'll say about masks, one exception to what I was telling about the societal kind of cultural habits and practices. If you ever go to a dentist, if you ever actually go to a physician's for surgery, to an operating theater, you would not see anybody without a mask. And why is that? That's to protect the patient, and to protect the wearers, from the patient as well. You would actually not go to you would think it is completely unacceptable to have your surgeon, without a
not
mask.
wearing a mask.
Yeah, or a dentist, without a mask. Yes, it's a special situation, but that is actually not so far off of what we are talking about mask wearing right now. Why would a dentist and a surgeon wear a mask? To protect the patient and to protect themselves. And that's exactly the same rationale that we would apply, in protecting ourselves and others from the COVID virus as well.
Okay. As we move into fall and winter, historically, that's, a big, other virus, flu, cold. How difficult will it be for, physicians, doctors to decipher just without doing any, swabs, which is which? And how do we know the difference between a
So
cold and flu and if we have COVID?
yeah, so I think it's going to be again unprecedented winter for us, who live in these parts of the world,
Yeah.
because we have not had a pandemic like this at the same time during the flu season. So I think a couple of things. One is that anybody who have cold, fever, muscle ache, almost in that order, and if they feel that they have to get tested, so they will be able to actually identify whether you have COVID. It is really important that if you have the virus, that you are identified as having the virus and isolate and so forth, right? Stay home. So nothing changes in that sense, compared to what we'll do today. If
Right.
if you get those symptoms, we call 811, call our physician, get an appointment, and get a, and get a test. But but in the winter, it is also the case that the regular flu season might actually be lessened, I think, because of all the precautions that we
Mhm.
have been taking. We have been taking, we've been washing our hands like we never washed our hands before, this pandemic, and we are wearing masks, I mean, like we have never imagined we'd be
Yeah.
wearing masks, And not only that, we are also really not circulating ourselves very much. We are not really, kind of, putting ourselves in situations where we might come into contact with people who are sick,
Right.
So I think that these are all exactly the same precautions we should be taking for influenza, and flu.
Yeah,
So
no
I
kidding.
think that, while we are cautious and we are concerned what might happen during the flu season in the winter when we are all inside and so on, I think we are already taking a lot of precautions that could also help us not getting sick,
Okay.
from the flu. So I think that logically, if it were to work out this way, I think we might actually be okay. Again, number one, you still have to be very cognizant that the slightest symptom that you have to get tested, because that is the number one priority.
Yeah.
And but you keep doing all of the precautions, all of the right behavior that you're doing, and not only you might not get COVID, but you may not also get, your.
Flu, cold, what? Yeah. Do you think just how things are now, like we see in offices, people are more distance in restaurants, people are more distance. When we go to, a store, they now have those kind of shields. Do you think this is our new normal? Do you think even if a vaccine were to come tomorrow that we would just, all go back to how things were? Or do you think now that we have this kind of caution in our nervous systems that this might be how things are from now on?
Candice, that's a really interesting question. I wish I knew exactly, how
It's a
things might
loaded
be.
question.
Yeah. I mean, I think this is what everybody's actually thinking and talking about, in a way, or thinking at least. Um, I don't think that we will return exactly to where we were pre-COVID. Even after we have a vaccination, few vaccinations, in few countries, and many people, have got the vaccination. I don't think we'll go back to pre-COVID, era. I think we will still be very careful about mixing and mingling in large groups, especially if we can do that.
Yeah.
There are places and situations it is very difficult to not mix and mingle. If you're taking transit, a subway, in a very busy city, even in our city buses, at the peak hour, in some, at some times, you might be actually, very close proximity, very close to other people, and so, but I think we will, like, I like the way you said it, in our nervous system, I mean, I think in our nervous system, we might have sort of programmed in, a sense of wariness and a
Yeah.
sense of caution, about mixing and mingling a whole lot with people that we don't know or we don't live with, and so on. And then, of course, there are so many other social changes, I think, probably are here to stay. The way we work, you
Mm.
know, and the way we actually treat people, the people we live with, people we don't live with, etc. I mean, with kindness,
Yeah.
and so on. And because, there's a sense that we have gone through a hardship, and we have come out, come on the other side, you know, we have survived it, we are intact, and we need to actually not take our health for granted. That we need to protect our health and the health of other people as well.
100%. I completely agree with that. Realistically, when do you think a vaccine will actually be, properly tested and distributed? Because I know that that they are ramping up production, and the regular protocols, I'm sure they're shortening them just to get something out there. But realistically, what do you think?
Yeah, so kind of actually multi-part answer, because I think there are about 120 odd trials that are running worldwide, and then about half a dozen that are in phase 3, meaning that they are actually testing, a vaccine among a small group of humans,
Yeah.
patients who volunteered for this, and so on. So I think we already have come to the phase 3 in few months,
Yeah.
6 months, which is unprecedented. We have never seen, vaccine development accelerated, to the point in about 6 months, we are at phase 3, testing stage. So I think that we might actually have a virus that could be marketable, that could be given to, populations, not the test group, but
Yeah.
widely, populations, probably in, sometime next year. I mean, we are in August, so maybe end of this year to early next year. But that's only one challenge. Getting the virus that is marketable and that is actually can be offered to populations is only the first challenge. Very important challenge, but
Yeah.
that's the first challenge. Then there's a second, third challenges, and that is, how widely could this be, made available, and to whom? You
Right.
know, I mean, vaccinating 80% of Canadians, which is about 25 million people, you know, is no easy task.
No.
It is a logistical and cost nightmare, and how do we do this? Is anybody's guess actually right now, and how do we actually kind of have some equity involved in distributing, viruses that are effective, you know,
Yeah.
would would certain groups of people, get it first who may not even need it, who are not vulnerable necessarily, but because of their position, their social class, their social position, or countries that are rich,
Right.
and powerful, of this world, people who live in those countries, get first rather than other countries. So those are, challenges that will follow the discovery and availability, of several vaccines.
This is why you're the expert. You think about this globally and locally, just like your motto. So, yeah, I mean, those are all great things to consider because, yeah, I mean, the cost of this and accessibility and, like you said, the logistics of it are going to be very interesting when it is released. So the next question is, and I don't know if you have a mask around, but what are just some, like, to demonstrate, if you can, the proper way to put on a mask and to take it off? Because I have seen this, and then I've also seen people out in public, as soon as they leave, a public place, they rip it off, but they are grabbing it in the areas that they shouldn't. Can you just demonstrate how to properly put it on and take it
In
off?
fact, I had taken a mask out, and I think I left it upstairs.
That's okay.
So I'll just describe it,
Yeah.
And first of all, I think that we are really talking about non-medical mask or, handmade mask, fabric-made mask. First of all, I think you want to have a good quality mask, by which I mean you want to have a mask that is woven, that is made out of woven fabric, not knitted, for
Yeah.
sure. That actually has a very close view that you cannot see the light if you were to hold it up to a light and so forth. So you want a very good quality mask. You want a mask that covers both your nose, the lower part of your nose, like starting in the middle of your bridge of your nose, all the way to covering the chin. So the base of your chin, around the chin. And also it has to have a seal in four directions, top, bottom, and side. Yeah. So there should be any gap, when you put on the mask. You hold the mask by the string or the loop, that you are going to be, putting over your ear or tying around your back. You don't actually handle the mask in the middle. So the middle area, which covers your mouth and nose, is the most sensitive area. That's where all the work is done, to protect you, and you don't want to actually contaminate that area. So you never handle the mask in the middle. You always from the edges, from the strings or the loop, and you place it first over your mouth and nose, and you put the loop around.
Okay.
And you do a little test to see whether there's any gaps, in a gaping openings, on the sides or on the, and I like mask that actually has a wire that actually can mold around your, the bridge of your nose.
Okay.
One other thing, I think comfort is also paramount, and not only the quality. I think you, especially if you're going to be wearing for, not for 10-15 minutes, but if you're wearing for hours, you want to have a mask that sits very comfortably, on your face. I have worn masks that sits a little bit away from your mouth, and that actually makes breathing a little bit easier. But you get used to the breathing with a mask. In the first 5 minutes, I mean, I wore it 2 hours ago when I was outside. It's always a little bit cumbersome.
Mm-hmm.
You feel like, it is like, what is this? But after a while, you forget. You do your normal breathing, and I think it works fine. It needs to be washed, and I iron my mask, and ironing it actually will kill the bacteria. So it's high, that's a lot of heat, and so you could press the outside of the mask after washing, or even if you had just only worn it for 10-15 minutes, and rather than washing it, I would iron it, give it a good source of heat, and then wear it again. I hang it up. I don't actually usually put it in a bag or anything like that. I hang it up so that there's air circulating, all around it.
Okay. And what about masks? We have been seeing masks with like the filtration system built in, these nifty masks. Is that necessary? Would you recommend that?
I think that it is recommended as a third layer, but at the minimum, there should be 2 layers, of mask, not a single layer. Most masks actually have 2 layers in an inner layer, that is usually cotton, that makes the comfort and breathing easier, and a closely woven outer layer.
Okay.
And most mask actually has a little opening where you could put a filter in there as well. And I would recommend that if you could find one of those masks,
Mhm.
those are the ones to find.
Okay.
There are masks that are form fitted around, around your nose and mouth that has a seam in the middle. It is recommended those masks are lesser quality than the ones that are pleated, and has no seam in the middle. Just
Okay.
because actually when you have a seam, which means it has a minute, small, small openings,
For step to get
where,
through.
yeah, yeah. So, and that's exactly where you are breathing as well,
Yes.
and it is sitting right over your nose and mouth. And it is recommended that if you could find a mask that is pleated rather than creased in the middle of your face, that's a better mask.
Okay, good information. Obviously, the big topic right now, kids going back to school, the reopening plan. Should parents be concerned right now, just as we know our current numbers in Saskatoon and kind of where the outbreaks are in the province? Specifically to Saskatoon, do you think there should be a big concern with kids, re-going back to school and kind of mingling with each other?
And things are changing, on this issue, uh, if not daily, certainly by, weekly.
No
Uh,
kidding.
Early this month, if you were to ask this question, I would say, yeah, there's a huge amount of concern. But now that we are at the end of August, and many things have happened since the release of the Saskatchewan school reopening plan, in
Right.
early August. All of those things that have happened in the last 3 to 4 weeks have been in a positive direction, have been to clarify how we would protect our children, um, and have the flexibility built in, so that each school division, even within schools, you know
Right.
that there are more steps taken, not fewer, more steps taken to keep our children safe and healthy. So right now, we are about a week away from schools opening. I would say, caution
Yeah.
caution it needs to be exercised. You never do anything recklessly, you never take anything for granted, but I think that sense of heightened concern that we had in early August actually has lowered
Mm-hmm.
quite a bit. There are a lot of steps put in place. Resources have been, given or identified, both at a provincial level as well as a federal level. We have $150 million, for this year, at least right now,
Right.
for schools to put towards keeping our schools safe. So I think that parents should continue to be vigilant and very cautious, but not really be lose sleep over this, each night. I think we have a plan, and now we have to put into action and be very flexible and monitor how things are going, day by day, week by week, and be prepared to take action, adaptive action, as and when that is needed. So I think that is the key thing. There may be some families, Candace, where they will make a decision
Right.
based on their child's health, their comfort level with their child going out and mixing with other children. Um, they will make a decision whether to send children to school or keep them home, or do both, part time. So that actually, that individual family decisions should also be respected, and accepted.
Right. Do you anticipate if there is a spike that we will see again, once again, kids being sent home and then the technology kind of taking over? Is
Well,
that
I think the online and remote and online education, is always there. It's
yeah,
kind of the fallback option, and you build from there. So that's never taken away. Um, I think that again, if there's outbreak or cluster, in a school, um, depending on how wide that is, whether it is 2 cases or whether it's 20 cases,
yeah,
or whether it's in elementary school or within high school, or whether it is in Saskatoon in a very populated neighborhood, or whether it is in a rural community,
right. Yeah,
in Saskatchewan. All those things need to be taken into consideration in making those decisions about um, partly shutting down a school and moving all of the learning and teaching online, or or doing it, with some mix, some
right.
high.
Okay.
Uh, the back the background level of transmission in the community is a key factor to take
Right.
into account.
Okay.
So we have 10 active cases. Like I said, in the largest city in the province, and that's not very many cases for
No.
this base
Right.
population.
I mean, what we know about little kids, like it's hard for them to sit in a seat for 5 minutes, let alone, follow all the rules. What can parents do early on to just kind of teach their kids about, wearing a mask and social distancing? Because, you know, they're gonna run into each other when they're out in the playground. It's hard to contain and control them. What are some tips or tricks parents can do to kind of get their kids to follow along?
Yeah, it's been a while since actually our kids were elementary school age, or high school. Candace, it's a very good question, and kids are going to be kids.
Mhm.
Whether during pandemic or before or after, kids are going to be kids. They're going to have a lot of energy. They're going to want to interact with their friends. They're going to want to touch them.
Of course,
Yeah, they're going to want to, they're going to share things with them, etc. So I think in the early days of return to school is going to be the most challenging.
right.
I think kids will have to be prodded, reminded, cajoled, and maybe even bribed, you know, to 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 basically sort of keep to themselves, or
Right.
if they're interacting with their best friends, to do it from a little bit of a distance, and to do it outside, in the
Yes.
playground, and so on. Hopefully supervised, by some adults. I mean, those things are never they they never go out of fashion.
Right.
Supervision. They always need to be there. So I think that the first few days are going to be very challenging. It'll try the teachers, and God bless them, and for what they do. But I think that it's going to try them. It's going to try their patience. But I think that kids, just as adults, they learn.
Yes.
They adapt. In fact, they may adapt and learn much better than some adults have or could or want to.
Very true. Very true.
So just because they're children, uh, doesn't mean that actually they don't get it.
Yeah.
I mean, some children might get it better than adults do. So I think monitoring is the key thing there, Candace, and having some patience, having some flexibility, and sort of saying, this is not like all or nothing.
Yeah.
It is a continuum. It's graded. It's not all or nothing. If 2 or 3 children were to kind of get too close and kind of well, we watch them, but that
Yeah.
doesn't mean the next time, they couldn't distance themselves,
I think there are ways too, and hopefully parents and teachers can get creative with turning it into a game or, like bedazzling a mask or, so I'm sure we'll see all sorts of fun, creative ways that parents and teachers will try to implement this. But patience, I think, is the key point there, and and knowing that, the limitations of just children in general. So, that's awesome.
Yeah, and I think we have to tell them why. I mean, I think that is the important thing. I think they have, parents educate them,
Yeah.
and teachers could strengthen that, can, say the reason we are doing this for these, in order to keep us safe this way.
Right.
And we hope that this is not going to be forever. This is going to be only until, you know, we have a vaccine, or this virus is no longer a threat the way it is today, and then we can actually, sort of readapt to, the previous way we were dealing with.
Exactly. We're running out of time here. Time flew by. So I want to just jump to culture and ethnic groups, because the big thing here would be communal living. We know that some cultures it's just a natural thing to have, your grandchildren or the, children, babies, and grandparents together in a household. Do you have any recommendations on how, as parents are going back to work, children are going back to school, how can we keep, grandma and grandpa, aunts and uncles, everyone safe at home when people are coming and going?
Yeah, that's a very, very tough one.
Yeah.
Candace, very tough one. I mean, I have come across suggestions that that people wear masks, for example, and continue to wash their hands, and kind of distance themselves within a family,
Right.
within a house. Again, you could only do that if you know, if you have a big house, and few people, I mean, not everybody could do that. And, I mean, some of these sort of suggestions we are, like we hear, cannot be practiced by everybody,
Yeah.
so I think that is, so I think that for a while, at least, until we really see the virus not become a threat anymore to us, I think the interaction between generations, the grandparents and the grandchildren, I think have to be done very cautiously.
Okay.
So, I mean, if I'm in a household where there are three generations, grandparents, parents, and grandchildren, I would actually try to distance and have minimal interaction between grandchildren and grandparents. There are ways to interact without actually having to sit on grandmother's lap.
Right.
And, I mean, there are ways to interact, show your affection, show your care, without having to be physically, face to face right now.
Right there. Yeah.
And particularly when students are returning to school and coming home, I would really suggest in those multi-generational families and households to be aware that now your bubble
Mm-hmm.
has just expanded, you know, in unknown, in unknown dimensions. You know, if there are 15 or 20 students who are cohorting in a classroom, those are 15 or 20 bubbles
Right.
that that is represented there, and each of them go to 15 or 20 different households. Yeah, so we can imagine how complicated, how easily this can get away from us.
Right.
So I think the best approach would be to minimize contact between generations, particularly if your grandma and grandpa already has some health issues. I would really think that that would be a reason to not interact very much physically, but still show love, still show affection in both directions, and and sort of keep in mind that this is temporary. And I keep saying that it may seem like there's no end to this, but there will be an end to this. There will be an end because we have a vaccine,
Right.
or because the things we do today are going to protect us, in 2 months' time. So if we don't do the things that we are talking about, today, we
Right.
might be stuck in this for far longer than we would like.
Last question, because I know we're just pinching time here. We've heard a lot of people saying that, you should take this supplement or take, this pill or this medication, and that will protect you against COVID-19. We know a healthy immune system protects you against COVID-19, but is there any recommendations around vitamins or supplements or, anything that people should be just making sure that they're taking and absorbing to help them out?
So Candice, this question about what can people take in order to boost their immune system or to actually ward off the virus, or kill the virus even if they had it, falls into one of four categories of what we now have coined a new term called infodemic. Infodemic.
Mm-hmm.
It's in a contraction between information and epidemic, right? So it's sort of the fake or false or exaggerated information that really doesn't have a scientific basis. We already dealt with one, and that is actually how the virus came to be, and now we are dealing with another one that is actually about curing, the virus. And so I think you do everything you can to keep yourself healthy and your immune system healthy. Eating well, getting sleep, and keeping your hands and so on clean is probably the best protection that you can have at this time. Not necessarily any vitamins per se.
Okay.
Take vitamins for other reasons, not for COVID-19 necessarily, and not any other, not herbal tea or anything like that. I think I know of no curative agent, that I've come across.
Perfect. Perfect ending to this very informative session. I really appreciate you again taking the time. I know we have lots more questions, so hopefully we can bring you back on sometime, maybe in a few months as we kind of reassess how things are going. If people want to learn more or just get more information, what's a trusted source that they can go online and search for information?
Anytime, Candice. I'll be happy to, appear again. And in terms of trusted sources, I really think that the Public Health Agency of Canada, as a Canadian source, is probably the most trusted, agency and the source. I think any university-based government sort of, formal institutions that we know of, we trust, are also the trustworthy sources for this information today and always, and not necessarily your Instagram or TikTok, or your Facebook. Unfortunately, I don't think, or WhatsApp messages. I don't think those are those are to be trusted. Public Health Agency of Canada, Health Canada, World Health Organization. These are. They live or die by that credibility that they have.
Right. Okay.
And that's who we want to go with.
Awesome. Well, thank you so much for your time, and I will hold you to that that saying that you will come back and talk to us. And for people that tuning in, if you want more information, please visit our website, trulyalivefoundation.org. Thank you so much.